ideas or suggestions or questions?
IABDM Healthy Hygiene portion of our Zoom meetings. And for those of you that don't know, we meet weekly at this time, and it's separate from the Zoom meetings that the IABDM is having for the general membership, which anybody can attend. This is really just for hygienists, and we're networking tonight to talk about ozone. So we're going to open it up for anybody that wants to talk about ozone and have questions and answers. And I know we use ozone in my practice. I brought my ozonator home. I'm using it at the house right now for ear insufflation. I know offices that have gotten bins, like large Tupperware bins for storage, drilled a small hole in it and stuck a tube down in there from their ozone generator so that they can put some of their possibly reusable things like a gown, possibly a mask, anything that is more fabric and not elastic in there, and then ozonate it for a little while. So I'm curious to hear how some of you all are using ozone in your practices.
Actually, we're seeing emergency patients now, and what we're having them do is Dr. Molika was kind enough when he did his ozone webinar, what was it, last week?
Yeah.
He put together a cursory protocol that he was recommending, and we're basically following that right now. We're doing a lot of research on our own to see what is going to be the best practices, but right now we are having everybody pre-rinse with the medical grade ozonated water, and actually it's oxygen ozone, because those of us who are using ozone, you have the two generators. You have one that uses oxygen out of the tank and converts it to O3, or you have your ozone generator where it pulls the oxygen from your ambient air, which then concentrates the nitrogens, which you don't want that. So we're using the oxygen ozone, and we're having patients rinse with that for a full minute. They swish, gargle, 15 seconds, spit out, and they do that 4 times. We're having them do that, and then we're putting them on the nasal insufflation, the ozonide, for about 10 minutes before we even touch them. And that way, hopefully the whole head and neck cavity is pretty zapped. So if there's any aerosols created, unfortunately a lot of the patients we've been seeing are extractions or, palliative treatment, but we're trying to make sure we minimize the aerosol. When actually even using the elephant, we call it, some people call it an elephant, some people call it a snuffleupagus, or the mercury removal, the large evacuation system. We're using that also at the patient's chin to minimize the aerosol, because we're trying to keep it as minimum as possible. But I personally, again, this is my personal, not non-scientific belief, I'm very, very comfortable with the use of ozone. The fact that it is so virucidal and that it was so effective against SARS, that when SARS, which is also a coronavirus, was out and about, it was about 99.2% effective in killing that virus. Now, COVID-19 is about 80% similar to SARS. So my personal comfort level is pretty good with the use of ozone, in addition to the other protective measures that we're doing, minimizing aerosols, using proper PPE, which thank goodness we have. The office that I'm working with, I don't practice clinically any longer. I do more training in the practice. We are pretty fairly well stocked with we've always had face shields because of the mercury removal. So we're using the face shields, the PPE, the gowns, the masks and all that. And we have the hair bonnets already. Now we just ordered the shoe bonnets, the shoe whatever covers. So we're going to be doing that. But going back to ozone, whatever the CDC and OSHA are going to recommend, we're without a doubt have to follow state guidelines. This goes for everybody, whether state, what country, doesn't matter. You need to follow state and country guidelines. But what we can do in addition to, above and beyond, in my mind, is going to set us apart and how we're going to be able to serve our patients. I mean, for crying out loud, the ADA said that for pre-rinse, they want you to use peroxide. have the patients rinse with peroxide. I mean, heck, ozone turns into peroxide. So, you know, ozone is a little bit better because we know that it does definitively kill viruses. So, in my opinion, we're doing a step ahead. We're a step ahead. So,
along those lines, the IABDM wrote a letter. Most of you are not even aware of it, but we wrote, or I wrote a letter basically saying that the only, I'm not turning mine on, the only safe place for you to be to get your teeth cleaned or have fillings done is a biological office, because we use, you know, protective masks and we have ozone. So I sent that letter out to the president, the governor of Texas, the mayor of Houston, our representatives, our senators, the ADA, the Texas Dental Association, the Houston Dental Association. And if you guys have any other contacts, I am happy to send that letter out to them as well, so that they understand that there is a safe place for people to go, but we have created the higher standard of care, which is a PROTECT protocol, which we've been using for mercury removal, but it is perfect that it is, even the languaging is perfect. You know, IABDM tried to follow the IAOMT in calling the protocol the SMART protocol, and they asked us to cease and desist. They asked us not to use that terminology. So many years ago, we came up with the term PROTECT protocol: protect your staff, the patient, and the planet. And it couldn't be more perfect now that it's actually labeled that, because it's not just about mercury removal anymore. Now it is about protecting the staff, the patient, and the planet. So it becomes much more fitting. But that letter is out there. Anybody wants a copy of it, they can email me and I'll be happy to send you a copy. And you have full right to send it wherever you want. I want it to get out there, the more the better.
That's it. That's fantastic. Because if you think about it, I mean, I don't mean to sound like this, but I guess I do. A lot of times we were ridiculed, you know, by the fact that, you know, we were wearing these spacesuits, quote unquote. We were wearing spacesuits, or a bunch of kooks that, you know, that's so unnecessary. Now everybody's clamoring to do what we've been doing for decades. And I think it's absolutely hysterical, because we knew the dangers of dentistry, you know, the mercury, and we also knew about, you know, the bacterial load and viral load. We talk about that with our patients' healthcare. So the fact that we were ahead of the curve, we started this back in 1979 with the HDA, and then the IOMT in '84 and the IBDM in '85. We've been doing this for decades, and now who's laughing last? And I don't mean to sound so snarky about it, but it just, you know, that's why I feel so strongly about what we do, and I've had since for years, that I've always tried to defend it, despite what other people said, and the fact that people are looking for what we've already been doing. We're the leaders of it, so that's why we want to try to be able to have these webinars and sessions that people can ask questions. People who are not practicing this way, they may have questions. We want to be able to answer them, because, you know, we're the leaders, and, you know, that's how you're going to get the information. You can find it on the internet, but it's going to take you a long time to sift through all the ridiculous amount of information and be able to disseminate it and be able to implement. We got those protocols already put together.
So we look at some ways that you can use ozone. You walk in your office in the morning, you turn on your ozone generator right from the get-go. You start making some water right away. You're going to use that water through your system, your whatever system you're using, as you know, pour that water in there, and that way the patient is getting rinsed or Cavitroned or piezoed or whatever you're doing with ozonated water. You take some of that water, you get silicone ice cube trays, and you fill those silicone ice cube trays with the ozonated water and go ahead and freeze it. You can send your patient out with Ziploc baggies of those ice cubes. I'm going to give you a tip. It is really good for stain removal. If you got a stain on your carpet or stain on clothing, use one of those ice cubes and rub it on there. Is stinking amazing what it will take out. I have no idea why, but it works.
Well, then peroxide, you know, use peroxide on stains and pulls it right up.
Oh, well, I mean, I've used it for more things. Wine. Oh, no, not that I would drink any wine. But,
hey, I'm coming to you, Dawn.
Even on the carpet in the office, there's a small area that's carpeted because most of our office is VOC, whatever, and tile and everything else. But there's an area, and when it got a stain on there, I used some of the ice cubes on there. But to go on with that, then of course the nasal insufflation, and because we can work with head and neck, you can do all of that safely. If you're going to use the nasal, you have to run it through your olive oil, and you want to have a fan going in the room just to make sure that they don't take in too much. It might be easier for you to do it through ears. Same thing, you might want to have a little fan going there. Doesn't have to be for very long. I would stay away from in-office use of rectal, although it's a great thing to use.
You just gotta adjust the chair, depending on what you're looking at. Sorry.
But then you've got your ozonated oils. So don't forget to send your patient home with some of these ozonated oils, not just for like gum problems, but maybe a canker sore or herpetic lesion on their lip. Teach them they can use it anywhere. If they use it on a wound on their hand, although that's outside of your scope, you're talking about skin problems you want to stick around the lip and the mouth. But those ozonated oils are not something that you want to forget about. It's terribly time consuming to make those ozonated olive oils. It is much more economical for you to actually purchase them. And there are a bunch of different companies that make it in safflower oil or olive oil, and they stay stable for a really long time in your refrigerator. I mean, you open it up years later, you still smell that frickin' ozone in there. So those are just a few ways that you can use it in your dental office. But I'm going to encourage you guys, get a small generator for home. Because if we ever have a second wave of this come through, you need to have something for your family that you can use, not a vaccine, something that you can use that will boost your immune system, that will help antiviral, antibacterial, antifungal, antiparasitic. So if you want to have a medicine chest at home, it needs to be, $1,000 to $1,500 unit with a medical oxygen tank attached to it. And that usually comes with those units that are about that price range. You usually get a really small oxygen cylinder that goes with that. And as long as you have a source to fill it, whether that's a fire station or a dental office, so that you can refill those tanks, you are good to go. Anybody else use ozone in their office in any other capacity?
Like Dawn was saying earlier, moving forward, I think a lot of us are, well, I say us, but hygienists are concerned about moving forward, how they're going to be able to manage the aerosol. So we talked a little bit about with the using the external evacuation systems, but a lot of people are saying, well, I'm using my Cavitron. I can't live without my Cavitron. I have to use my Cavitron. Of course you do, because you need to break down that biofilm. But if you're using that medical grade, that oxygen ozonated water, not only do you have your patient your pre-rinse, then you have them on either the iris insufflation or the nasal insufflation, so you're reducing that viral load in the head and neck. But then you get a dual select. So instead of having your piezo or your Cavitron, well, I use a magno-restrictive, I used to. You hook up your magno-restrictive to a dual select, and you fill that with the medical grade ozonated water. So now that's running through your unit. So as you're Cavitroning, guess what? You're now using that ozone there. So now you're really reducing the bacterial load. So you're not going to have to worry as much, because even though you have your N95 and your face shield on, you can go, because that aerosol, any aerosol that you are getting is not going to have that heavy viral load that you would if you have that regular, if it's hooked up regularly to the sewer line, the regular one.
Right, that's what I was talking about earlier when
exactly. So that's why.
And we didn't even mention the pocket insufflation.
Yes.
You don't want to forget to use that pocket insufflation, and maybe that just becomes a new standard as well, because rinsing can only get so far. But if you're actually using, the small little, it's not really a needle, it's more like it's a
cannula,
yeah, a metal tip that goes on the end, and you glide it around the sulcus just like you would if you were using a laser. and you see the pocket bubble. And so you know that you have ozonated whatever crap was down in that sulcus.
Right.
And that might be a new standard of care, that before you start scaling or anything else, that you actually run around the mouth, which couldn't take you 2 minutes to do if you did it the way I'm talking about doing.
I love it. Great minds think alike, Dr. Dawn, because I'm assisting the office in creating a new protocol. And what we do is, prior to touching the patient, we take our sample for the slide, the face contrast. We do the pH test. Next thing we do is we do an iodine disinfection. We use potassium iodide. So I suggested, instead of doing the potassium iodide disinfection, why don't we just do the pocket insufflation throughout the mouth? Then everything's been knocked out. So
what about adding a lingual ascorbic acid test in there as well, which is stupid easy to do, and that doesn't tell you the amount of vitamin C that is in the rest of the body. What it tells you is what part made it to the mouth. And you're going to see that your patients are really low in vitamin C, because you should be able to put those drops on there and it just goes away really quick. And if it doesn't, it's a blue stain. If you guys have not done it before, Google a lingual ascorbic acid test. It's cheap, stupid, easy to do. You don't even have to charge your patients for it. And basically what you're doing is saying, I don't know how much vitamin C you're taking, but it's not enough to help the periodontia.
Wow, I love this. I thank you, because we're like screaming at our patients, making sure you're taking C, making sure you're taking C, make sure you're taking D.
Right, and if it's not showing up here, what is the glitch? Maybe you need to refer that person back to their naturopath or their MD, because maybe they swear that they're taking vitamin C, but for some reason it's not being absorbed and it's not making it to the oral cavity.
This is perfect for now, because yes, absolutely, it's for the periodontal condition, but during this craziness, it's good, because you want to make sure our patients that are coming to us are fairly health conscious, I would say, to a degree.
Yes.
So I would definitely say so. This was, like you said, if it's an easy test and it's fairly inexpensive, then we can monitor.
Insanely easy to. Again, it doesn't tell you what your vitamin C level is in the rest of the body.
But if they're low, then they need to figure it out.
And there's some reason that it's not getting to the oral cavity. Another thing that I wanted to point out, and I don't know if you guys have seen this, I have to go back and look at what the name of this product is, but there's this little helmet that has a face shield in front of it that is completely enclosed that you wear, and it has a little battery pack that hooks on, and air is being pumped in from the back. So there's absolutely no fogging, and you're in a safe, clean environment, but you're not hot either. You know how sometimes you get all that crap on and there's no air movement on your face, and you start getting claustrophobic and hot. I actually, let me see if I can even find it on here. It was through the Facebook group that is through Teresa's mommy dentists. I'll have to go through there and look at what it is, but I actually looked into it, and let me see, I got another way here. You have to forgive me for a second in my ignorance of okay, here we go. It's called CAPR, Powered Air Purifying Respirators, by maxair-systems.com. And so I'm going to encourage you guys to look on there, and maybe it's something, let me type this in here. It is maxair-systems.com. I'm not trying to necessarily promote something, but we have to figure out ways to keep ourselves safe. I know when I was in hygiene, I bought my own instruments because I hated that somebody would dictate what I had to use, and they were usually not sharp anyway, and I'm a fanatic about sharpening all my instruments. And so I just had my own. It didn't matter what office I was in. It didn't matter if I was temping somewhere. I was just anal about having my own. I think you take care of stuff when it's your own better than other stuff as well. But if you look at these masks, they look like they would be pretty okay to wear. They have several different styles. Some of them even have almost like a little cape that comes down over the shoulders that would help protect you from aerosol, even on your neck, which we don't often think about. I'm going to remind you guys that the OSHA regulations, the way they're written, you come to work in whatever you want to come in to work with, your pajamas. But then you put on your scrubs there at the office, and those scrubs do not leave. You do not go out to lunch in those scrubs. They are nasty. You take them off at the end of the day, and either a laundry service comes and picks them up, or there is a service that is there. You have a washer and a dryer, and you're able to take care of your own linens and things there in the office. And then you put on your pajamas and you go home. Please, please do not wear your uniforms home and put them in the washing machine with your children's clothes. And then expect that you're not going to pass all kinds of things. You just don't think about the bloodborne pathogens. And now that the aerosols are really coming to the forefront, even with the snuffleupagus, you know, I'm looking at the possibility of trying to encourage people to put a plexiglass shield over it to prevent the splatter from going as far as it could. Do you understand? Everybody knows what I'm talking about with the snuffleupagus, the little elephant nose that comes up close to the patient's mouth. If there were a plexiglass shield on top of that, it would reduce the spread going down towards the patient's toes. The other thing is you have to, there's a plastic, what do you call it? Like a sleeve that the snuffleupagus uses. Well, what a waste to the environment. So I was talking to Dr. Scott about getting someone to make out of a material that would be breathable, but could be laundered there in the office, so that you could just take it off, throw it in the launder, put another one on, and it would actually go deeper down into the mouth, because the one that they have doesn't go very far down in the mouth. And, you know, then that just becomes a breeding ground of gunk down in there.
They actually, that's a good idea, because there's another unit that I see is being promoted a lot, where it's similar to the ones that we use, but it's like 3 arms. It has one like this, and then it's like 3 like angles, like they're sharp angles, and they were saying that it's very difficult to clean. Well, and I'm looking at this thing, and I'm like, oh my God, it's like, I can't even imagine what is going to grow in that thing. So
well, right, and I think that one has 90-degree angles, and it doesn't even create good vacuum.
Right, so and everybody's buying it. They're like they're losing their minds over it, and I'm like, how are you going to keep that clean? Ooh.
Right, and so my encouragement to dental hygienists is, maybe you have to be your own advocate, and maybe what you have to do is buy some of this stuff yourself, because the dentists are going to be overwhelmed. They're going to be overwhelmed with providing PPE. And I know if I want to work, I'm going to make it such that my doctor wants me there. And so if I bought my own snuffleupagus, and I bought my own, that cap thing that wouldn't have to be replaced so often, and I took care of myself, it's going to be hard for dentists to bring their hygienists back. Patients are not going to want to just run in and get their teeth cleaned like they were before. It was hard enough to convince them that they needed to get their teeth cleaned instead of get their hair cut. And trust me, they're going to want to go out and get their hair cut and colored before they're going to come in and get their teeth cleaned. So it might behoove us to be on the cutting edge and actually say, I come as a package deal. This stuff is my stuff when I'm here in the office and I'm working, and if I don't have a job, I'm going to another office with my stuff. And that might even be an ozone. So you come as a package unit, that I provide ozone for this office in the hygiene department, because again, I'm looking at some of these younger dentists that are on the verge of going bankrupt. And if you want to work, you're going to have to be a part of the solution.
Exactly. Now, Maddie was asking, she actually bought the longevity unit for herself. Good. And she's asking, I don't know of anything off the top of my head, any research that shows that it's the reduction of the viral load in the plume, in the aerosol plume. I'm sure Phil's got something, and you probably do too.
No, I don't, but I'm sure that Phil does. I mean, of course there would be, but I don't know that anybody's done the research on there to prove it.
Right.
I talked this week to a guy. How cool is this that it could play into dentistry? This guy, for a living, comes in with an infrared camera and shoots your air conditioning ducts, looking at where little vortexes are in your office that maybe air doesn't circulate very well. And then you get an aerosol in your office and it gets caught up in a corner of your room and just circulates over and over and over again. And so I was telling him, oh, dude, if you're smart, you should go into dental offices with your gizmo and show them, because it just might simply be redirecting an air vent in the office in order to correct that problem. But now we're going to have to start thinking of things like that.
The funny thing is that if you really think about it, okay, yes, this is going on now, but we've been being exposed to all this bacteria and viral stuff, parasites for years.
And Fran, you and I have had this discussion.
And now all of a sudden, we started practicing when AIDS first came on the forefront back in the early 80s. No gloves. If I went home with blood in my cuticles, no mask, nothing. Didn't matter. You know, if you didn't have blood in your cuticles, it wasn't a good day. So we had to change, and it was so hard to work with gloves. Oh my God, I had to clean at the time my boyfriend's teeth with gloves on. I was like, I can't even clean your teeth. I can't feel my instruments. Now the thought of working without a pair of gloves or a mask, oh my God, are you kidding? So there's a lot of changes that we're going to have to address. But if you think about it, I'm not saying us, but in general, dentistry has become complacent because there were protocols that we should have been following from the gate. From
but you don't know what you don't know. You know, when I first got into dental hygiene, you used an alcohol wipe to wipe down your Cavitron tip. You never took it out and sterilized it. Grosser yet, the Prophy cups. We would just run them underwater to get the Prophy paste out. They didn't even go in Barbasol. That was it. They were clean. Then you polish the next person's teeth with them. It's a no wonder that the CDC said that the #1 place hepatitis C was passed was a dental office. Yeah. I mean, you know, it's disgusting to think back on those days. I remember when we used to sanitize the saliva ejectors.
Oh, yeah.
And now they're all disposable, you know, but we didn't think that was gross back then. We just thought that that's what you were supposed to do. So I know the future hygienists coming forward are going to go, you guys used to practice doing what? Well, you might as well French kiss the patient.
Oh, that'd be interesting.
But I tell you, some of those perio patients, there's no way. There's no way.
Oh my goodness me! But but the thing is, like, I hear what you're saying as far as like, oh my God, how do we ever practice like that? But because of us practicing that way is how we learned why you need to do more protocols and have more infection control.
Practicing because we don't know what in the hell we're doing.
Yeah, you don't know what you don't know. Once you know, then you can't unlearn it. So then you just have to keep moving forward. Now that we're going through this, we've become complacent. Was everybody wearing their scrubs on? Yeah. Were they changing their? Nah. So, but now, oh crap, we were taught that in school. I was taught that in school back in the Ice Age. You're not supposed to wear your uniform on. I did. Now we're going back to what we're supposed to do.
We go into dental offices. Years ago, probably 30 years ago, I started a business called Learn CPR where I focused on teaching dental offices CPR. So I'd go into their office and we would pretend that somebody coded in their office and they have to worry about how to get them out and what team member does what. Anyway, in that process, it was very interesting because, yes, AIDS came along, hygienists had to start wearing gloves. And I remember one day when a dental assistant came up to me and said, you know, are you supposed to change your gloves after every patient? Because our doctor gives us 1 pair of gloves a day and we just have to wash them in between patients. And I said, oh my God, if you leave the room, the way OSHA rules are written is you must take your gloves off And when you come back in the room, you must don a new pair of, oh, no, he won't let us do that. Matter of fact, if there's still anesthetic in the carpule, well, we'll use it on another patient. And I said, oh, hell no, you can't do that, because when they inject, they aspirate, and so there's body fluid in that carpule. Really? You're right. You don't know what you don't know. And in a lot of offices, they're uneducated dental assistants that are right out of high school. No one's taken the time to explain to them. They know the needle goes in and that they need to replace the needle on every patient. But I could not believe the height of ignorance to think that someone would reuse a carpule, or that they would wash their gloves and try to use them on another patient.
Back in the, when HIV really became, you know, this was back in '84, I think it was, when I was in a particular office, and there was a shortage of gloves. We couldn't get them because there was a rant, just like now, you can't get PPE. Could not get gloves. So we were running extremely low. So my office manager comes to my operatory and said, Fran, I'm going to need you to you're going to do is you're going to reuse the gloves. You're going to wash them. You're going to see your patient. You're going to wash your hands with your gloves on, and you're going to reuse your gloves. I'm like, no. She goes, no, I need you to do that. I went, oh, okay, no problem. Did I? Hell no. I made sure I changed my gloves for every patient. I didn't care if we ran out. If we ran out of gloves, then I guess I can't see the patients. I was not going to do that and jeopardize my health or my patients. But yeah, they were asking us to do that. And then this is somebody who did know better, but then again, some who don't know. That's why, we are so lucky today that we have so many seminars and webinars and CE units that we have to take. We have to learn about this stuff. And like I said, back to what I was saying before, we have so much more protocols on top of what we already know. Like what we learn in school, we do above and beyond. We do on top of, in the biological world. We give that extra boost of safety to our patients and to ourselves. I mean, for gosh sake, we're exposed to a lot of stuff. And if we can do our best to control it, and like you were saying, Dawn, it's so exasperating when you see somebody, like, better, I know better, we all know better, but somebody doesn't know, and our first knee-jerk reaction is like, what do you mean you don't know? How do you get upset? But then you're like, okay, they didn't have the training that we've had, so we just have to breathe, take it, and then say, okay, let me show you and explain to you why. And so, if we go into our offices and you see people using a pair of gloves, touching something, and then they go touch something else. No, it's our responsibility because we know better. It's our responsibility to say, no, let me explain something to you. There's something called an aseptic chain, and that chain can't be broken, and because of blah, blah, blah. So you tell them, once you tell them, they'll be like, oh God, and they'll probably
right.
do it. It's how you approach it.
It's a good time right now that each of you, especially those of you that are maybe thinking about getting certified as a hygienist, you could simply make a PowerPoint. I call it a PowerPoint movie, but you turn on the voice and you auto advance the slides, and it creates like a little presentation. Simply once you put your gloves on and you're in somebody's mouth, you can't open your drawer and reach inside and get 2x2s, or get a new saliva ejector, or get an instrument without having contaminated the entire drawer.
I'm getting a visceral reaction just by you saying it.
But
my body's crying.
I see people do that all the time. They don't understand they're in a surgical field. If they would get educated and say, okay, if I'm going to have to open my drawer, I've got to take my cotton pliers here and open the drawer. And then I have to have another pair of cotton pliers in order to reach inside the drawer and get some. So when I'm making my trays, I might have to have 3 or 4 extra sets of cotton pliers here, just in case I need to get something that I don't have. You reach out, you got your gloves on, you open the drawer, you get a toothbrush out for the person. Let me show you how to brush here. Oh, let me get you a thing of floss. You still got your gloves on. Your complete room is contaminated.
Anybody ever see that movie, If Saliva Were Red?
Yes. Oh my God, we had to see that in school. Yes.
There you go.
Yeah, I didn't know the name of the movie, but I know exactly what you're talking about.
I had to buy it from my office. I said to my office manager, I said, please, can I get this DVD because these people need to see it. I mean, not all of them, but there was a few. I said, they need to see it
But
because you
Fran,
don't
that
realize.
needs to go up on the website. We need to incorporate that into the certification for dental assistants and staff and
Absolutely.
hygienists. You know,
And
right
even
now is an opportunity where we've got to educate if you hygienists want to work, you got to talk to your receptionist so your receptionist knows what to regurgitate to a patient about why your office is safe. Because if she doesn't know what ozone does or what steps you're doing to keep your office safe, she is not going to be selling getting people in to get their teeth cleaned. So it's an opportunity for you now to work as a staff and say, hey, I created something that you can tell the patients, please go see this. Like I see that Sarah is on, you know, she works at Dr. Scott's office. It would be an incredible opportunity for you right now to create a small video that says, our hygiene department is safe. Let me give you 12 different reasons of things that we do that you will not find in another office. And then put that up on your website so when a patient calls, the receptionist can say, I'm glad you asked that question. Sarah has answered that for us. Please go to our website and you will get to see what it is we do to keep you safer.
brilliant.
So there's opportunities all over the place that are not just marketing, but you have to be little missionaries going out there to other hygienists in your, you know, Carol up in Canada. You've got to get hygienists together to get on board and look at it as an opportunity to have them step up their game.
Definitely.
And I know that you have a tight-knit group up there that is, you know, big on education. So we just have to, push ourselves to the front of the pack and say, we have information that you can't live without. You've been poo-pooing us for years, saying that we're the ones that don't shave under our arms and our legs, like Fran. Pointed out to us.
I'm sorry. Everybody's hysterical when I said, yeah, we smell like patchouli and we don't shave our legs. You know, no, it's all evidence-based research, for gosh sake. It's real. It's real. And once you, it's my favorite thing to say, once you learn, you can't unlearn. And,
yes. And Maddie asks on here, says that she's bad at IT, good at dental help. It's a push for using IT. Yes, I mean, if you don't know how to work a PowerPoint, I'm going to encourage you to learn how to do that because it's really pretty fun to do. And then once you get that, you just go up to the top. And if anybody needs help, I will Zoom with you and show you how to do that and just turn it on and then you start talking. Use your own computer with the microphone that's built in. If you go in and look at most of my webinars that I do, that's exactly what I've done. I have a fancy mic here, but I don't use it now because the computer I have works great. And I will happily help you so that you can create something for your office. The only thing I would ask is that you share it with us too.
Can I say something? Everything you said was great. I wanted to go back to the vitamin C. I just looked up what it costs to run an intracellular vitamin C, $2.44.
But that doesn't tell you what got to the mouth.
No, that's intracellular. You can do intracellular and extracellular, and you're right. It's just throughout the body. But, I mean, it's not that expensive to, you know what I mean, see exactly what's going on in the entire body.
And that part's true, but then you end up with, you know, will your office send out for labs? Otherwise, you're going to, which I encourage, network with a primary care. But this is an in-office test that'll take you less than 20 seconds to do.
Yes, I agree.
And could possibly change the rest of somebody's systemic health besides just their oral cavity.
Right, I agree.
Any other questions on the ozone? Because my ADD kicked in and we didn't just talk about ozone. We got off on this one.
No, this is good. And remember, it's quarter to 6.
Yes, I know.
So
I got
another webinar.
Yeah, in just a minute. So but I wanted to make sure everybody had an opportunity to ask questions or feel heard. Reach out to me if there's anything you need. I got so many fires lit, just like Fran does, trying to make good use of my time, but God has blessed me in some funky ways, and so I'm trying to really be of service to as many people as I possibly can right now, including my neighbors and everybody else. So that includes you guys. If you need anything, just let me know. What was the question on here? It says from Connie to everyone. Equipment, basic, what? Equipment like for ozone? Yes? Okay. So if you go back and watch the Zoom meeting that was with Teresa Scott, it was one of the very first Zoom meetings. There's some links on there to both Phil Malika and to Eric Zaremski. There are a few things that you do want to be sure that you get with these ozone units so that you don't get one that breaks down basically after you get it. And you're going to have some replacement tubing because ozone does have a tendency to eat through some of this stuff and it starts to leak. You'll know because your unit, you'll turn it on, you'll smell ozone everywhere throughout your entire operatory, down the hall, in the bathroom, across the way. And you'll know that you've got to replace your tubing and put some new stuff on. So you want to get with a company where you can get stuff. The other question on here was the lingual ascorbic acid testing. Just Google. There's so many different companies out there. It just comes as a little kit. It's, if I remember, it's like a little blue tablet that goes in this tiny little squeeze bottle with a little metal tip on the end, and you hold it away from the patient's tongue and drop a couple of drops on there and then start counting about how long it takes to go away. Again, we're not looking at what's in the body tissue. You're looking at what made it to the mouth. So if they have some type of poor perfusion to the mouth, okay, they've got diabetes, they're going to have poor perfusion of oxygenated tissue to the oral cavity. Their vitamin C may not get there. Maybe they have a problem absorbing vitamin C. Then the vitamin C is not going to get to the mouth. It's important what makes it to the mouth because that's your focus, is the mouth. So everything, try to keep you safe, and everything that you're doing, you're going to find a way. If you're using IV vitamin C in a dental office, that person's got a perio pocket of 5. And if not, you just made one. Don't take it that far. But my point is everything's got to come back to dentistry. So any other questions? If not, I'm going to turn off the recording part. You guys get certified, please. It's free right now. It's a learning process. It's not that hard to do. And then there's a project, and I just gave you some ideas of simple things to do. Wouldn't take you 2 or 3 hours to do, and you'd have it done. Is that it? All right. Well, I love you guys, and I'll talk to you next week, and I'm going to turn off the recording.